Hey there! Ready to fuel your mind in just minutes a day? Join me on Brain Boosts by Max16RN on YouTube for quick, powerful facts, tips, and ideas to keep your brain sharp, inspired, and informed. Hit that subscribe button and let's boost your brain together.
Recognizing the early signs of Alzheimer's disease and other neurological disorders in people under 60 is essential for prompt intervention and effective management. While these conditions are often associated with older adults, they can and do affect younger individuals, sometimes in subtle and unexpected ways. Understanding the symptoms and knowing which diagnostic tests can clarify the situation empowers people to seek help early, potentially slowing the progression of disease and improving quality of life. First and foremost, one significant indicator of early Alzheimer's or another neurological disorder is memory loss that disrupts daily life. Everyone forgets things from time to time, but if a person under 60 is repeatedly forgetting important dates, relying heavily on memory aids, or asking for the same information over and over, it may be cause for concern. This kind of memory loss is different from occasional forgetfulness and often affects short-term memory first, like forgetting a conversation that happened just hours ago. Second, difficulty in planning or solving problems can signal trouble. If someone who was previously organized now struggles to follow a familiar recipe, manage bills, or keep track of appointments, it may point to changes in executive function. Neurological diseases often impact the brain's ability to think critically and logically, making tasks that require concentration and complex thought much more difficult. Third, challenges in completing familiar tasks at home, work, or leisure are worth noting. A person might find it hard to drive to a familiar location, remember the rules of a favorite game, or handle routine work responsibilities. These difficulties go beyond simple distractions. They persist and worsen over time, interfering with daily life. Fourth, confusion with time or place is an important red flag. Losing track of dates, seasons, or the passage of time, or forgetting where they are or how they got there, may be more than just absent-mindedness. If someone finds themselves lost in a familiar environment, it's crucial to pay attention. Fifth, trouble understanding visual images and spatial relationships may be present. Early Alzheimer's and other neurological diseases can affect visual processing. This can manifest as difficulty reading, judging distances, or determining color or contrast, and may lead to problems with driving or recognizing faces and objects. Sixth, new problems with words in speaking or writing can appear. People might struggle to follow or join a conversation, repeat themselves, or have trouble finding the right words. They may call things by the wrong name, lose their train of thought, or have difficulty with written communication, which was once effortless. Seventh, misplacing things and losing the ability to retrace steps is another common sign. While anyone can occasionally misplace keys or a wallet, someone with early neurological disease might put items in unusual places, such as a phone in the refrigerator, and struggle to remember or locate them later. This can lead to frustration and suspicion that others are stealing or hiding items. Eighth, decreased or poor judgment is a symptom not to overlook. People may make poor financial decisions, such as giving away large sums of money to telemarketers, or they may neglect personal hygiene and grooming. These shifts in judgment and decision-making are often subtle at first, but can become more pronounced. Ninth, withdrawal from work or social activities is another warning sign. If a once outgoing and engaged individual becomes apathetic, avoids social situations, or loses interest in hobbies, it may be more than just a mood change. This can be a direct result of the frustration and embarrassment caused by other symptoms, or a sign of depression that often accompanies neurological decline. 10th, changes in mood and personality can occur. People may become confused, suspicious, anxious, depressed, or fearful. They might be easily upset at home, with friends, or in unfamiliar places, and these changes can be difficult for loved ones to understand or manage. If one or more of these signs are present, it's important to seek a professional evaluation. Diagnosis begins with a thorough medical history and physical examination. Cognitive tests, such as the Mini Mental State Examination, MMSE, or Montreal Cognitive Assessment, MOCA, are commonly used to assess memory, attention, language, and visual spatial skills. These tests help determine the extent and nature of cognitive impairment. Blood work is often ordered to rule out treatable causes of cognitive decline, such as thyroid dysfunction, vitamin deficiencies, infections, or metabolic issues. Brain imaging studies, including MRI or CT scans, can reveal structural changes, strokes, tumors, or patterns of brain atrophy typical of Alzheimer's and other disorders. Sometimes, a PET scan is employed to detect abnormal protein deposits or assess brain activity. In some cases, genetic testing may be appropriate, especially if there is a strong family history of early-onset neurological disease. Lumbar puncture to assess cerebrospinal fluid biomarkers, including beta-amyloid and tau proteins, is sometimes performed in specialized settings. Neuropsychological testing by a trained psychologist can provide detailed insights into areas of cognitive strength and weakness, helping to differentiate between Alzheimer's, other dementias, and reversible causes of cognitive impairment. It's equally important to consider other neurological conditions that can mimic Alzheimer's, such as frontotemporal dementia, Lewy body dementia, Parkinson's disease, Huntington's disease, or even multiple sclerosis. Each of these has unique symptoms and may require specific diagnostic approaches. Early and accurate diagnosis is crucial. Treatment strategies, including medication, cognitive therapy, lifestyle modifications, and support for families, can be more effective when started early. Some medications, such as cholinesterase inhibitors or memantine, may slow the progression of symptoms in Alzheimer's disease, while other treatments may target different neurological conditions. But beyond medical intervention, early diagnosis allows for planning, financial, legal, and personal. It empowers individuals and families to make informed decisions about care, support, and future goals, and to connect with resources and support networks. If you or someone you know is experiencing these symptoms, don't wait. Reach out to your healthcare provider and ask for an evaluation. Early detection can make a profound difference. Talk openly with your loved ones, keep records of changes, and advocate for yourself or those you care about. Neurological diseases are challenging, but with awareness, support, and timely care, individuals and families can face the future with greater confidence and hope. If you notice these signs, take action today. Your health and well-being are worth it.